Welcome to the GFY podcast, a podcast by healthcare professionals providing insight on how to navigate your health so that you can go fix yourself. The GFY podcast is hosted by Mike Bruno, a chiropractor and athletic trainer, and me, Michael Stant, an athletic trainer certified strength and conditioning specialist. Although we are healthcare providers, we are not your healthcare provider. We will discuss general health interventions in this podcast, but you should not take that as health advice that works in every situation. Before doing anything on your own or making any lifestyle changes, please consult with your own physician. This podcast and views from this podcast are separate from our full-time jobs and our own opinions. If you're enjoying the GFY podcast, please leave us a review on your listening platform and or subscribe to our podcast at YouTube. Links to our show can be found in the show notes on any platform that you're listening to. In today's episode, we discuss a case study on myself. We discuss my current back pain and what I'm doing to treat it. Bruno describes his process in dealing with people with acute episodes of back pain. This is a great episode for those of you who are starting to have some back pain, you're unsure of what it means and what to do. We hope you enjoy this episode. And we are live. And I don't have to do the intro anymore. It's getting weird. It's getting weird not having to do the intro anymore.
AI is taking over.
It did not take over. I just go record it afterwards.
What do you mean record? You recorded it multiple times?
No, after we record here, I go and review the episode and then
you don't gotta mansplain me.
That's not mansplaining. That's me just telling you what I do.
Oh man. Do you know how gaslighting? Like, you're familiar with that?
Yes, and I got a story about gaslighting for you once you go.
There's basically my brother's entire friend group, that's the only way that they communicate, and it after hanging out with them for a whole weekend, it throws you for a loop. It feels like normal, so you just start doing it with my fiance, my friend, my friends, my family, and I'm like, oh wait, this is not normal.
And I still can't fully explain gaslighting, but I can definitely kind of talk about it here because I think it's what it was. I was talking with someone and talking with a patient, and they're like, I'm having pain in my right knee. No, my left knee. I was like, okay, well, we'll figure it out which knee it is. So it gets up on the table, points to her right knee. And she goes, yeah, it's my left knee, pointing to her right knee. I go, that's your right knee. She looks at me, and goes, yeah, all right. And I was like, hold on. I know my rights and lefts. You are not going to get me on this whatsoever.
Oh, man. That is the definition of gaslighting.
Is that right? Yeah, that's what I thought. That's definitely a definition of it.
Let's ask ChatGPT.
Oh, man.
Let's turn this into an AI episode.
AI and health. I mean, honestly, that could be an episode. We're not going to dive into that, but
dude, it's crazy.
My opinion is if you're not using AI within your, I'm not going to say daily life, in your weekly life yet, you're behind.
Dude, I have it on my schedule to talk with ChatGPT every day. Gaslighting is when someone messes with your mind to make you question reality so that they can control or deflect responsibility. They deny things they know happened. Oh, that never happened. That's my brother to a T. They twist or shift blame. They make you feel confused or going crazy. And over time, you second guess yourself. Oh, yeah, it's deceptive. With great power comes great responsibility.
I feel like it's when you get a group of people in on something of hey, we're gonna keep telling this guy that this happened to someone, and everyone else is in on it except for the one person, right? That's how you would do it.
Do you think our friends listen to this? Because I know exactly what you're talking about.
I'm gonna move on. I'm gonna move on and talk about something more important. My back.
Uh-oh.
Yeah. I don't think people realize me and you still get pains and aches and
contrary to popular belief, Mikey's not invincible.
I am not invincible. It's really sad. But yeah, just for whatever reason, this weekend I did a long run. It went great. Had some, threshold running with it. And for whatever reason, woke up Monday just back pain. And I can tell you, it's honestly more with sitting and standing. When I'm moving, it's pretty much fine. Like I can pretty much kind of ignore it and whatnot. But I figured I'll go away next couple of days. It's a whatever. I'll be honest, haven't schedule this week's a little bit rough. Didn't get to lift until yesterday. Maybe played a part in it. But last night it sucked. It was like for whatever reason, super painful. I was at work. I worked elsewhere at 5 a.m. and then went to the other job. So just lots of sitting and standing, not much moving around. So I just got stuck in bad positions. And last night I was like, oh man, this thing is like I am struggling with it right now. But yeah, I mean, right now it actually kind of feels decent. But it was all mainly
standing.
I'm actually sitting right now.
Yeah.
I'm actually sitting with one leg up, like one leg up, bent, like. I don't know if that's helping. But yeah, most of my pain. So this is when I started getting concerned because most of my pain was PSIS on both sides. So I was like, it's an SI joint, right? If anyone's listening, they probably understand that the dimples in your back. That's kind of where the pain was. So I wasn't as concerned. But like last night, it was going anywhere. It was like going into like my tailbone for whatever reason, and I was like, this is super, super weird. So luckily, when I have a wife who's a PT, I was like, all right, you're going to do some things on me right now. And what we actually kind of found out, she tried telling me I was rotated one way or the other. And I was like, don't waste your time. Don't tell me that I'm rotated. I know I'm not. If you want to get into that,
Courtney, please help me. But everything you say, I'm going to tell you you're wrong.
Yes, essentially.
You sound like my fiance, except for the difference is she's not a PT.
But so while we were doing it, so she did like the muscle energy technique, the glute bridge thing, squeeze in, squeeze out. I could not fire my adductors whatsoever. Couldn't do that. Now, based on that limited information that I just told you, how do I fix my back?
Oh, like a little case study?
Yeah.
I like it. A couple different things that you said during that. The sitting or standing thing is actually a game that my cousin plays. He'll just so if you and me were on one side of the phone, like we were hanging out in person, and it's like, oh, let's call Pat. And you guess he's sitting, I guess he's standing.
Oh, okay.
Pat picks up the phone and I'm like, hey, are you sitting or are you standing? And he's like, sitting. He's like, yeah. And it sounds so dumb, but it's actually a really fun game.
Yeah.
And it keeps you on your toes. But for you, everything that you were going through, even the small little adjustments that you made sitting down, there's no part of me that okay, first of all, let's start from the top. The first thing we always have to do when pain comes on and it's relatively sudden and it's confusing, right? It's not like an obvious what caused it. First, we have to rule out the scary stuff. So with your lovely fiance, did you guys rule out all the scary stuff?
Yeah. I'm not worried about any of that. She was pushing down and everything. I was going
to say, so how'd you do that? How'd you rule out the scary stuff?
There's a lot of palpation, just like, hey, any pain, any sharp pains. And I wouldn't call this a sharp pain either. It's dull, achy, sometimes a burning across, but that, I don't know why. I've actually never had that feeling before.
Yeah.
So that was strange, but
so some things that I look out for.
No radiating pain. It's all centralized.
Yep. So for the English speakers out there, and the people without medical degrees, what we're talking about is if it is a sharp stabbing, shooting, burning type pain, those are more serious symptoms where you have to be more alert and aware of what's going on and what's causing your pain and potentially look for help a lot faster from a professional. If it's dull, achy, not very intense, it's very equal both sided, similar to you overdid it in a workout like muscle sore, usually that's on the safer side of the spectrum. So being able to clearly differentiate what is usually safe to experiment with or oh boy, hang on, we have to actually go seek some help here. So that's the first line in the sand that you have to draw. So For you, it sounds like you drew the line where it's like, hey, like this is safe to like experiment out and work through, right?
Yeah, yeah, that's what I went with. And me too. Like, well, I'm gonna try to figure out on my own first, unless I get to a like, right. I don't feel crippled. Like I'm still moving around, doing all my things. It's just sitting and standing. I just get into super uncomfortable spaces.
Mm, mm. And it was pretty even both sides, or it was one side?
It goes back and forth. Like sometimes it's mainly like today it was mainly my left side that I
Mm,
was feeling it.
okay. And what have you tried so far?
I have done a lot of I actually did do a little soft tissue work. Like I went and got while I was working massage gun, like rector spinae, my glutes, so my low back, my glutes. I did some glute work, a lot of like single leg glute bridges. Um, what else did I do? I was actually doing step ups, like because I've noticed that like hip extension really helps me. I did some rotational, like thoracic spine rotational work too. This is also just
Mm,
like I was working on some running stuff as well. So that's why I started doing some additional rotational things and
yeah.
just kind of realized like, oh, I'm kind of like limited right now
Yeah.
in all of this. So I started focusing on that.
So this is a very good thought process. Like you've been in this world so long that it just feels like ABCs to you.
Mm-hmm.
But to break it down from someone who might not have like been through as many reps as you, like the first thing that you did, was it like exercises or was it soft tissue, like where you're like massaging it out?
So I hate massaging it out first. I went exercises first because I hate like the actual feeling of massage. That might sound weird to people, but like I hate working on specific soft tissues
Yeah.
as like a feeling thing. Generally, I would actually like right. I would generally on someone else be like, all right, how about we try to get you some more range of motion first if they have limited range of motion, right?
Mm,
So like for me, what I was actually I didn't talk about this. What I was noticing Monday and Tuesday, like I couldn't get to my toes.
okay.
It wasn't painful,
One
but
step at a time, Mikey. Time out. How
sorry,
did you determine that you had a limited range of motion?
I couldn't reach for my toes
And
initially.
you normally can.
Yes.
Okay. Then what'd you do?
Then
At
I
what
actually
range of motion do you think was missing there?
so I thought it was going to be my lumbar spine. So like I went and did like cat cows first, and then like I also actually did some hip flexor stretching as well because I
Why?
felt like
Why?
because my lumbar because your hip flexor attaches to your lumbar spine to your low back, so it wasn't allowing my spine to go into flexion.
Like curling your
Curl.
spine, like
I couldn't
slouching.
curve my spine. And to be honest, I'm still because I had Courtney take a look at it last night. I'm still struggling with that a little bit.
Hmm. So that brings up a good point. A lot of so you're in a very acute sense, meaning like
Mm-hmm.
it just came on and it came on strong. A lot of the times where I see people get stuck the most, especially with back pain, is that their body is doing that. It's in that protective phase. It's like the low back muscles are tight
Mm-hmm.
and have you more extended and don't let the low back flex. But people have been living in that environment on a much lower level for months at a time. So they think it's normal and they think that's what's going to get them from, or they don't know that that's not a normal thing,
Yeah.
right? So when we show them a picture and their back's flat as a board when they're trying to touch their toes, I'm like, that should be bending.
Yep.
Like, oh, really? I had no idea. So when we teach them how to actually bend through the spine, like stuff we're probably about to talk through now, then the whole world opens up. But for you, the window I usually give for acute stuff is 2 weeks
Mm-hmm.
usually, where it's like, hey, if something really weird comes on, you don't know why. It's stuff that you can work through. If it's still a serious problem in 2 weeks, then that's when we have to really buckle down and put you on a rehab plan. Likely, if like in your case, it's especially when it's more acute, everything's kind of jumbled and fuzzy. It's like everything hurts.
Mm-hmm.
Whatever. I've boiled it down to good and bad, right? So if it feels good, it doesn't you don't have to be specific at first. If it feels good to do something, you should do that. If something feels bad, you shouldn't do that. Like that's as simple as I keep it with people in the acute phase. How do you feel? about that?
Yeah. I mean, I'm cool with that. I will say, like, just from a mentality standpoint, because I keep getting stuck on like the sitting and standing. It is like a hard mentality to get out of. Like, I'm having pain, and it's the initial thought for even for me, it's still like I should rest. Like maybe I just overdid it on my run this weekend. I don't know. Maybe that's what did it. But then I have to like get over that too, because I'm like, well, just sitting for long periods of time is bother, or like just trying to find a comfortable position to sit in does not help. So then I'm like, I need to move more.
Okay. Well, wow. You're so smart, and you sound like one of my patients.
Yeah.
It's
No,
crazy.
that's why
Everyone's human. It
I
doesn't.
revert back to it.
Yeah, because that's like that's your animal brain. It's like safety.
Mm-hmm.
But you even said it. We were like, hey, I think I need to rest. Rest does put this on a t-shirt with my face like going, rest does not mean do nothing.
Mm-hmm.
Everyone thinks rest means to just like lay on the couch like a potato. It does not. You going for a walk, rolling on a foam roller, like all those things can be considered rest. I think rest is spending time in positions that feel good is the best way to boil it down. Because if you're like laying, it's like, oh, I've heard this all the time. It's like, oh, I can't get comfortable. I can't get comfortable. It's like, hey, you find a position that's like not so bad. You're like, I have to stay here for 6 hours, right? And then as soon as you move, everything else is worse.
Yeah.
So like, that's not what you're saying, is it?
No, I wouldn't say that. Now I will say last night I decided just like I felt like whatever it was, I just felt like stuck in extension in like lumbar extension last night, which is probably part of the issue. So when I went to bed, I actually put a pillow underneath my belly and like lay down on my stomach to go to sleep, and that helped alleviate the symptoms. So like I was like, well, this is gonna help me be able to actually get to sleep. So
yeah,
I was happy about that.
So like you were able to recognize like so like we're talking. I feel like when I say shapes, people are like, this is not geometry, but like your spine makes shapes, your feet make shapes, like every part of your body makes shapes based on joint position and like moving. So your spine was making a certain shape. You recognize like, ow, this is bad. Then you use the pillow to essentially push your spine into a shape that felt good and that alleviated your symptoms, right?
Yeah.
Not a ton of science to that.
No, sometimes it's very simple.
Right. So like the go fix yourself mentality, right?
Yeah.
As long as you know, and that's why like when I work with clients, it's yes, we are doing things to reduce the risk of injury, but there's no injury prevention. So knowing that if and when things happen, you have the knowledge, the skill set, and the capabilities to think through what you just did. So that like, hey, like this random tweak pops up and it's like not, oh, I need to go run to the chiropractor and get my back cracked. The first thought is like, okay, extension hurts, flexion feels good. Let me do some flexion exercises and flexion whatever. And you know what I mean?
Yeah.
Like being able to self-diagnose and treat that in a situation like yours. Like, do you think you needed to go to 8 years of school to do what you did?
No.
Right.
And like to be honest, even like some of my initial stuff I did, like I could have read a book, like gotten like the Supple Leopard book, and
Ask
like
ChatGPT.
Yeah, actually probably. And like I could have at least trialed some of that stuff first based on like what I was feeling. Now, like, is someone gonna figure out that like, oh, it's like lumbar flexion that's bothering me? They're gonna figure out, oh, my thoracic spine's also a little limited, my hip external rotation's limited, and like be able to determine that? No, but like if you can do a full body movement and feel, hey, I feel tightness in this area, that's like a very simple way to maybe start trying to work on it.
Yeah, pain's a really good indicator of what your body doesn't want to do. So the more positions or shapes that you can find that not even feel good, but that just like don't suck, and rotate through those things, you'll feel a lot better, a lot faster.
And I'll say this too. Now, my mind didn't go here, but like this is what I think about too. It's like, because I'm probably after we get off, I'm going to lift. I'm going to do like a full lift. And the reason why it's like, when I squat down, like I'm not really having pain with squatting down, but like I think what a lot of people will think of it, they'll go, "Oh, I'm having back pain. I'm gonna stop squatting." Like that could they get into like I am fearful to move because that might cause me more pain as well.
Right. So, yes, I hear you. In a very acute setting, right? If you're so this is what I always talk about, like why I say movement prep instead of a warm up.
Mm-hmm.
So for someone like in that example, if you go to squat, body weight squat, or like holding like a 10-pound dumbbell, and that's excruciatingly painful on your back, why would you try to like barbell back squat?
Yeah.
That doesn't make any sense. But the movement prep might help you prepare for that movement, and then getting into actual weight training in a way that feels good and you're still able to push yourself will be more beneficial for you. But just squatting for the sake of squatting and pushing through pain is stupid.
Yeah. And like even then, like this work, I don't know if I'll front squat. I might goblet squat instead. So it's just like lesser intensity. I'll probably, do some like RFEs instead, and like maybe some single leg. Like it's probably gonna be a very like single leg light workout, but just enough so that I can feel like I'm getting at least the muscles work that I want to work.
Dude, the most sore my legs have ever been from a squat workout. It was a 70-pound dumbbell, and I did heels elevated goblet squats for volume.
Yeah. Well, that'll do it.
Yeah. I've back squatted so much more weight than that. Didn't feel not even like remotely close.
I'll be honest.
There's a huge difference.
I haven't back squatted in so long, and part of it's just like I don't think I could ever truly get in the right position is one to like make it work for me. Mm-hmm. And then two, it's like every time I did it actually just felt like my back got to work out, nothing else.
Yeah. And that's the whole thing is like knowing what works for you. So I have this conversation a lot where back squatting is a good example. Are you training to like PR your barbell back squat? Is that important to you? If the answer is yes, then we have to go down that rabbit hole and figure that out. But if the answer is no, you're just working out, there are a million other options that are probably more efficient than barbell back squatting for you to get general fitness workout goals.
Yeah, and I would say too, it's like this is another part of it. So you start having these pains. What's really hard, and it's something I've gotten way better at, is just like taking a step back from like the weight that you're at and like working on actual lifting form. Like, because I think that's where some people start lifting so heavy. They have the pains, but they don't want to like actually take a step back in like the weight that they're at.
Oh yeah, dude. I see. And you know what else? You know what else grinds my gears? Throwing it back is the people who feel obligated to redline their workouts like 6 days a week, where they're just like pushing it as hard as humanly possible and not giving themselves the ability to recover. So they're getting, if like here's the line where like progress is made. Mm-hmm. Instead of having a really hard workout where you like make progress, then you recover adequately to hit that spike again and like actually undulate through that and make that wave. People are just like, if here's the line, people are just 6 days a week, like hitting subpar workouts behind that line. On average, they're higher, but from actual gains perspective, they're just like wasting their time.
Yeah.
It's like, and people are aware of it too. They're like, like a good workout shouldn't leave you absolutely dead for the rest of the day.
No, it shouldn't.
Especially if you're like push yourself every once in a while, sure. But if you're doing that 6 days a week, it's a miserable way to live.
I mean, I would compare it to running where like, right, it's like 20% of your workouts or 20% of your miles are high intensity miles. Like when it comes to the resistance training aspect, you could do the same thing where only like, right, like what common thing people will do is, hey, my Monday, Tuesday workouts are like legitimate, heavy, got after it. But then like, say you lift Thursday, Friday, those ones are lighter and not as intense.
100%. What does it go? You got to go slow to go fast. That mindset works with a lot of different things.
It does.
Running being my most recent discovery of how true that is.
Yeah, isn't that fun? It's like you just wouldn't think it would work. You'd be like, all right, so I'm going to train slow a lot, train fast only occasionally, but then I somehow run my race much faster than I thought I would based
Oh
on
yeah,
training.
my track workout yesterday, I felt like I was flying.
Yeah.
It was great, and I'd slacked off for close to
A
a week.
weekend. Fine. We got plenty of time.
Yeah,
Although,
exactly.
yeah, I won't get. I mean, I just like giving you a hard time. It's a lot of fun. I like giving all the people a hard time.
You're built to be a coach. It's literally your MO.
Yep. Yeah. Maybe I miss my life calling.
Yeah. So like if I think we went through a really effective protocol. So let's boil it down.
Yeah.
Right. Ow. Right. Is like the inception. Something hurts. Then what's step one?
Evaluate it.
Yeah.
Figure out why it hurts.
Yeah. Figure out. Yeah. Figure out why it hurts. And then what?
Well, then I'm treating. But like figure out what movements help the pain. Figure out what positions help me.
Yeah. So figure out what feels. It's like literally like it gets hurt. Figure out what feels good. Or sorry, figure out what feels bad, and figure out what feels good, and do more of the good than the bad.
I think that's a simple way to put it, right?
It literally can be
Yeah.
that simple. And now if that and like that 2-week window, right? If you're not back to 90+% in that 2-week window, you're basically at 100. If you're not near that, then something else is seriously wrong.
Yeah.
And that's where like working with a professional comes into play. So like all the information's out there, ChatGPT, YouTube, like there's a ton of really smart people putting out really high quality stuff on there. It's not about the information, it's about the implementation. So for like acute pain, it's like, hey, I want to find stuff that feels good and do less of the stuff that feels bad in a very narrow window. We can get away with that, right? But over time, when people have like nagging pain and injury, it's like they don't really know which way is up. And like that's when it gets really hard to implement. Could be the right exercise at the wrong time, the right exercise in the wrong dosage. There's so many little things that can create such a huge impact in how you feel that it's the quotes. Hang on. If it was an information problem, everyone would be a millionaire with the 6-pack.
Yeah, because we know it. Everything's out there, but like there's definitely like a nuance to all of it too that the everyday person nor ChatGPT can figure out.
Right. And your back pain's not my back pain. So me telling you like, oh, do press ups because that worked for me might make you worse.
Yeah.
You know what I mean? So you have to figure out what feels good, what feels bad, and literally go from there. And then if you get stuck, then you ask for help.
I forgot to include one thing about all this. Saturday night after I did my long run for the weekend, I had an espresso martini and I did not sleep. So that could have easily
espresso martinis are not how you go fix yourself.
No, do not. Bad idea. Health, wealth, and happiness knows that's what the beans mean.
Man, for my wedding, we're getting married at I know you know this, but for everyone listening, we're getting married at a very popular bar down here at the Jersey Shore, and the most popular drink at said bar is part Red Bull. And
oh God, I'm not having it.
Well, Erica wants to make it like the signature drink of the night, and I was like,
did they tell you no?
No, I was like, I told her no. I was like, I get it, but if you're having people drinking these and they taste like pineapple juice, they're delicious, but like 50-year-old like or whoever like drinking 3 or 4 of them thinking they're just like a nice little cocktail and then having 800 milligrams of caffeine running through their veins, dance floor is going to be bumping, but
there's
no one's sleeping.
You can do a caffeine free Red Bull, right?
That's so lame. It's like decaf coffee or sugar free Jello.
News to you, my wedding, the espresso martinis were decaf.
You are
fooled everyone.
Yeah, he fooled everyone.
We weren't like the venue didn't let us have actual espresso martinis.
Were they like the pre-made, like they pre-made them or something?
Yeah, they were pre-made things. They're like, yeah, we can't give you like a legitimate one.
I can't remember if I had an espresso martini at yours, but I digress. Everybody, go get good sleep, good nutrition, work out. If it feels bad, don't do it. If it feels good, do it. And then if you're stuck and you need help, ask for it.
Go fix yourself.